I'm Nicole Person-Rennell. I'm the Medical Director for the University of Arizona Mobile Health Program. Thank you so much for considering our application for a core grant from the Community Foundation of Southern Arizona this year in 2025. This funding would provide critical support to the mobile health program to allow us to continue our work providing free healthcare for patients without health insurance in Southern Arizona. We've been around since 1976 and provide a family medicine and prenatal clinic with multiple clinics every week to provide access for people who don't have health insurance or have emergency-only insurance that doesn't cover the situations that they need. We see around 600 patients per year, over 2,000 plus visits, and this critical funding again would allow us to continue this work. We to provide access for our patients for health services, trying to reduce barriers such as transportation, lack of financial support that allows people to access healthcare and insurance that provides that support as well. The University of Arizona Mobile Health Program impacts our community in a variety of ways. We are able to provide direct healthcare, helping people who need to seek and access healthcare for their daily lives. We have a family medicine clinic and prenatal clinic, as well as offering vaccines, health screenings, and other work in our community providing healthcare for patients. We also have a bigger scope where we are able to do outreach events, provide health screening services, but primarily our work is clinical. Additional information on our method of impact involves our work with our community partners. No organization can thrive without incredible community engagement and work as a team. Just like when we raise children, it takes a village, and it truly takes a village to do community-based work as well. So some of our community partners include March of Dimes. Sonora Quest provides in-kind lab services. We have a number of school-based partnerships, including Sunnyside Unified School District. We also have support from Banner Health as far as infrastructure and some of the physician and medical assistants. The University of Arizona Mobile Health Program has recently analyzed our financial impact to help us better understand or demonstrate our impact in our community. For example, for every $1 invested in the mobile health program, our return on investment is $30. So we are able to really robustly and with high value show our benefit to the community and to our funders. Additionally, we have studied and evaluated our prenatal outcomes, since this is a coherent group of, or a cohesive group of patients that we can follow over time and see how they do. Importantly, we have lower than national average preterm birth rates and lower than national average first-time C-section rates for low-risk women who you otherwise wouldn't anticipate to go on to have a C-section. These are two important markers of maternal health and improvement in outcomes for our patients. Lastly, I want to leave you with a story about one of our patients. I could talk at length about our patients, but I will pick one story. We had a pregnant mom who came in at about 20 weeks pregnant. Ideally, I'd like to see patients in their first trimester, first part of pregnancy, but it's a huge barrier for a lot of our patients who try to get insurance. Unfortunately, for a variety of barriers, don't end up getting insurance and come to see us in the clinic. We got her plugged into care, provided free laboratory services, free ultrasound evaluations, and the critical care she needed. We did also order for her a detailed anatomy evaluation for her baby, which we offer to all of our patients, but work with a community partner to provide at a lower cost. That anatomy scan did show some concerning genetic findings, and so we were able to work with the patient with additional counseling and provided additional free genetic testing for the patient through another community partner, and get her better answers about her risk. We also were able, with the same team, to deliver her baby and see her baby in the hospital, who thankfully had a very reassuring examination and was very well. And then ultimately I was able to see her in clinic after she delivered and provide her with an IUD, which is what she desired for contraception, and give her the results for her baby, which thankfully showed no genetic abnormalities on final diagnostic testing after birth. So it was a happy outcome, but I also would like to think that that support that she received and the ability to seek care regardless of the outcome for her baby was meaningful and important for her to be able to access that information and have a healthy pregnancy and birth. Again, thank you for considering our application for the 2025 core grant through the Community Foundation of Southern Arizona. We are the University of Arizona Mobile Health Program, and we provide free healthcare for people who don't have health insurance here in Southern Arizona.